At the Roselle Center for Healing, we care about your health and want to help you take your health in a new direction, far from drugs and surgery. Knowledge is the key to optimal wellness and control of your health. We offer free health education on chronic health conditions and natural integrative medicine treatments. Register for free today.
Attend Low Back Pain on Wednesday, August 14th at 6 p.m. Space is limited, so register today. Call 703-698-7117 or visit rosellecare.com. That's rosellecare.com.
The information provided on Dr. Tom Roselle Live by Dr. Tom Roselle DC, interview guests, show co-hosts, or substitute hosts is not intended or implied to be a substitute for professional medical advice, diagnosis, or treatment. It is for general information purposes only. Information from this broadcast should not replace the appropriate consultation and examination process by a licensed physician. Always consult your own physician prior to changing any current medical directive or prescription.
Hey, everybody. Dr. Tom here, and I've got a great program for you today. Welcome to Sunday. Got a lot of things that are going on in the world, but, I want to pay attention to you right now, and I want you to get some information that you may not have thought about when it comes to your low back and your emotions. Did you know that your emotional state can cause all kinds of havoc, including tremendous amount of low back pain? That's right. It can cause that, and it's really uncanny because most people say, well, it's all in your head. Not really. Sometimes it's all in your limbic system. That's the emotional control center of the body. And what happens is that the body records emotional insult, if you will. I'm going to use the word insult simply because of the fact that we have highs and lows of all kinds of emotions. But when they're negative emotions and they're constantly there, we magnify, we worsen the impact that takes place. So look, let me kind of unfold that for you. And when we're done with this program, we go into the Ageless Health live stream immediately after this. You're going to find that there's some interesting things I'm going to actually show you today. I want to show you the flow. It might be a little complicated, but I'm going to try to dumb it down. And you're going to see what happens on an emotional and psychological and physical interreaction. It's real stuff, and sometimes we don't give it enough credence, and that's what we need to do. So let's start with simply this. Every area of your body has an emotional tag, and in your low back, it's not any different than that. And it can be something from a place of certainty or lack thereof, or it could be feelings that you've internalized and you don't want to deal with. You just kind of chew on them and put them away and don't think about it. So the emotional aspects can indeed play a very significant role in how your back is feeling. Now, on the 14th of this month at 6 p.m. at the Roselle Center for Healing in Fairfax, Dr. Harlan Browning, who we lovingly call the professor, and I are going to be sharing the platform, and we're going to talk to you about what happens with your back, but from a structural point of view, neurological point of view, but and also an emotional point of view. I'm going to walk you through that myself. I'm going to show you some of the things that take place from the stress, the anxiety, and so forth, and what happens and why it manifests itself. Now, it's not you're making it up. It really affects the tissue, the nervous system, causes inflammatory reactions, and so forth. Kind of tough to put your head around that, but I'm going to really lay it out for you. I'm going to show you what takes place. And there's all kinds of neurotransmitters and amino acids that are working or not working and are being depleted because of the constant stress pattern. But let's get into the program just a little bit today. And I want to encourage you, by the way, as always, make sure you follow me on all your social media platforms. We've always got something coming out, and I would like you to use that information to help yourself, help your family, and make your life better than you possibly thought was possible. So your low back and your emotions are interrelated. And how well do you cope with that pain sometimes causes a recidivistic cycle, an ongoing situation. So the physical and emotional impact of it, if you will, can determine the type of pain that you have. Sometimes it's just an ache. You can't move. You can't bend over. You're locked up. Your body won't allow you to move. Could that be an emotional thing that you don't want to do? Perhaps, maybe. And, there's article after article. You can go to Psychology Today, and there's a article that I read recently. It's called What Your Back Pain is Telling You. It's a whole lot about the emotions that we seem to dumb down, put away, not deal with. And, all of a sudden, over a period of time, it causes more problems than what we're talking about. So, that article is quite impactful. And if you want to find it, by the way, it's September the 11th, 2016. It's a good idea to consider that back pain that just never goes away, that you've done all kinds of things for, might have an emotional link. And if it does, it can be found, it can be fixed. There's ways of using very specific reflexes within the body to allow that to express itself and then go away. But let's talk a little bit about that pain-emotion connection, if you will. Chronic pain that just doesn't go away interferes with daily living. It affects concentration, it affects your memory, it affects appetite, you just don't want to eat, and it affects your sleep. So when it affects your sleep, you can't go into a restorative healing process. That process is important for anything to reset itself. So it's called a parasympathetic, if you will, platform, where that's where the body heals itself. But if you're constantly in sympathetic fight-flight, you're constantly in a stress pattern, you're constantly in a state of anxiety, you're constantly in a state of irritability, that often will exacerbate and cause pain to go through the ceiling because you can't heal. So you have the emotional overlay on the what? On the physicality. We see a lot of patients and military people that have been over in some really bad places, and they have unfortunately been exposed to horrific situations, and that PTSD is as high as it possibly can get. When that is at that level, you have to be able to identify it. And when you identify it and where it's coming from, then you can begin to resolve the problem. There's actual reflexes within the system that allow the body to do that. Do you ever notice that when you're under stress, you put your hand on your forehead and you just kind of put your head down and your breathing becomes more shallow? And we know how to get into that anxiety, stress-related situation. That is the way the body kind of protects itself. Putting your hand over your forehead causes a reflexive pattern to try to relax and calm and modulate that emotional stress that could be causing both acute and chronic low back pain triggers. So, then we go into the anxiety and so forth. So even short-term, non-serious symptoms can cause emotional distress. So if you react to something that happened at work, you react to something because your children or your grandchildren did something, and you say, oh my God, and you internalize it, you chew on it, that can cause very problematic situations, and compounded over a period of time becomes worse and worse and worse. Pain may feel worse during periods of anxiety, worry, sadness, upset of any kind. And that low back, that chronic low back pain, is influenced by the things that we're talking about. So if you're sitting there, your back is really tight, it's locked up, you can't bend over the way that you used to. And if you go in the wrong position, you kind of guard yourself, because if you do the wrong thing, you're going to hurt really bad. It feels like a knife going inside of you. That can be triggering mechanism from something deep down inside that you haven't considered. And so we have to make sure that we understand that and really dig into it. When a patient comes in, one of the things I'm doing is I'm constantly evaluating. I'm looking at their background. I'm asking them questions about, things that they do. Are they anxious? I can tell right away if, when I meet somebody, are they kind of internalizing things? Is their body pattern that of someone who's depressed, someone who's under a lot of stress, and so forth? Repressed emotion, those things that we don't want to look at. Repressed emotion, and sometimes like somebody abandoned us, or we didn't feel enough. We weren't good enough. Sometimes we feel that we were neglected, or we were neglected. And maybe there was an abusive pattern that had gone on years ago. Physical causes of back pain sometimes are just the surface of things that are underlying, and that emotional issue and the beliefs, the decision processing that we contribute to that back pain. It can be around our finances. It can be fear of so many different things, can cause it not to go away. So we have to make sure that we understand it. And here's the good news. The good news is there's ways of, without going through, sitting hours and hours and hours and hours with a psychologist, to be able to diffuse, if you will, those emotional patterns. Just for grins, by the way, go into Ageless Health stores. You have to go to my website, go to drtomroselle.com and go to the Ageless Health store. And if you go into that link, you'll find that there's a vendor in there that we support. Is called Lotus Way Flower Essences. And did you know that in nature, flowers and plants and trees and so forth have very specific energy wavelengths? We can call them vibrational platforms that can help dissolve, disseminate, break down the emotional onslaught, if you will, the constant irritation. So check it out. There's a free quiz in there. You can check that out. See what, and it's just about looking at certain things, but check it out. See what you think about it. And there's a couple other things in there that I think that you'd enjoy when it comes to that as well. But Ageless Health, go to Lotus Way site and check that out. I think that it's going to be fascinating for you. So let's talk about how the psychological pieces, the psychological and social factors not only affect back pain, but also how much the pain causes you to stop your life, not being able to do certain things. Sometimes pain is one of those things that we use so we don't have to do something else. Did you ever think about that? We don't do it consciously, but on a subconscious level, it's our only way of not getting involved in something, not participating in something, not committing ourselves to something. I can't because my back hurts. I can't do that because of whatever. And the excuses compound. They go on and on and on. So if that might be a problem, we're talking about the psychology of back pain. And, this comes from, by the way, another article that I read. I'm always reading. I'm crazy boy. International Association for the Study of Pain. And they were talking about the psychological and social factors not only affect back pain, but also how much the pain impacts one's life. So you can go both ways. You can say, I've got this back pain, and now you go into guilt because you can't do certain things, and that compounds the injury and makes it worse. The psychological and social factors not only affect back pain itself, but how much the pain, if you will, impacts your life. So, for example, if you're in a depressive situation, right, the depression, because of its skewing, by the way, things like serotonin, GABA, dopamine, and other neurotransmitters can make the back pain worse and increase the person's inability, I'm shying away from the term disability, inability that's associated with that back pain. Now, people with back pain, and it can go any way up the spine, but we're talking about your low back. We're talking about your low back pain. There's a lot of finger pointing of major depressive episodes, anxiety disorders, and so forth and so on. And it's well known. But what is not well known necessarily is how do you get out of that mess? So you have to look at several factors. Now, it's become a real physical situation. And if it goes long enough, now you got both. You've got the emotional piece that is expressing as pain, but you also have the underlying potential of causing real physical tissue destruction over a period of time. Remember, neurological, biochemical, emotional, they all work together, and you have to take them as a group. So pretty soon we have people that are avoiding different things. Their behavior shifts and it changes because they've got this back pain. But maybe it's the only way they can get out of something. Maybe it's because they don't think that they are good enough. And if they try at something, they're going to look foolish. They'll look silly. They're going to look stupid, whatever's going on in their brain. And so they have to come up with an excuse to not try. And that excuse to not try might simply be my back hurts. I can't do that. If I do that, I'm really going to get myself in trouble. So avoidance behaviors that are those things that might be underlying because of certain situations can cause a problem to be worse both emotionally and physically. Remember feeling less than, can't do it because of, echo back to the time that you were a kid. You know, I was recently asked something at a conference. There's this doctor who I think the world of, and she only focuses on the emotional side, the emotional physical piece. And she was picking some stuff apart, and she looked at me and she said, you know, there's something going on with you when you were very, very young. And she said, so you can test a muscle and you can have people think and visualize who they were at a certain stage. And if there's something that's not right neurologically or energetically, that say when you test the muscle will weaken. And so she, you know, she takes me all the way back to, goes through, you know, 0 to 5, and then something she picked up, don't know what it was. We talked about it later. I didn't know what it was at the time. And she said, what happened at age 3? And I said, nothing. I said, you know, my childhood was great. And so I sat there for a minute and I started thinking, and I said, you know, I went to kindergarten 2 years in a row. And she looked at me, she says, what? I said, yeah, but it was age 4. She said, well, it's close enough. What was going on? And I said, well, I was kind of a pain in the lower side to my grandparents and so forth. So being Roman Catholic, they walked me 2 blocks up the street and went to the Mother Superior and asked them if they could put me in kindergarten, and basically to get me out of the house. And I hadn't thought about that for years and years and years and years. And she looked at me and said, okay, doc, how'd that make you feel? And I said, not enough. And she looked at me and started laughing. And I said, yeah, that was an issue at certain times in my life for years. And, you know, I got over it, but I didn't realize where the trigger was. Something as small as that type of psychological piece can cause problems over time. Now, did it affect me physically? No, I was a crazy boy. I was a jock. I did all kinds of things, but there were other issues that were associated with that as well. Now, with our back and the pain that we go through, you know, that development of sometimes catastrophic pain. And when I say that, I simply mean because of the fact that it paralyzes us. We can't do what we want to do. And, you know, the pain level starts going up. We start dealing with it. We start taking medications, you know, muscle relaxers and anti-inflammatories, because our docs say, well, you know, whatever it is, it must be all in your head, that sort of thing. But when you look at this problem, as we do in our practice, it has to be a multidisciplinary platform. And if it's not, you know, we could end up with real significant chronic, can't get it done type of situation. So I want you to think about that just for a little bit. And on the 14th, we're going to touch on this. And I'm going to show you a couple things that may, you know, say, oh, I didn't know that. And there's other ways. There's cognitive behavioral therapy that you can do for yourself. That's the good news. And there's wavelengths that all this stuff is measured on, and I'm going to talk to you a little bit about that. But the problem is that pain intensity, the disability, the quality of life that, you know, is not there for you. It's important that you understand it. So listen, I'd love to have you there with us as our guest. All you have to do to register is go to drtomroselle.com or go to rosellecare.com. That's ROSELLECARE.com, rosellecare.com or drtomroselle.com. Register for the class. It's on the 14th, coming up in 10 days. And it's going to be at the Roselle Center for Healing in Fairfax. So if you're in the Washington metropolitan area and you're listening to this, please join us. We'd love to have you there as our guest. I promise you it's going to be an interesting night. Dr. Browning's going to get into the neurology. He's going to get into a lot of different pieces of the puzzle that are not thought about when it comes to back pain. And we're going to show you how these things can be turned around before you rupture a disc, before you end up with such massive spinal stenosis that no longer is able to be reversed without all kinds of stuff. But, you know, you've heard the term mindfulness therapies and things like that. But it's more than that. There's physical linkages to the emotional, cognitive, behavioral patterns. And you can begin to turn them around. And I'm excited to show you those. I'm excited to show you how that works and it comes together. But if you got back pain and you've been playing with it for quite some time and you can't make it go away, and it doesn't seem to, think about your life for a second. Could it be, and you don't have to answer this to anybody but yourself, could it be that back pain that you have is there because it's excuse, if you will? It's your story, which if you know me well enough, any stories I say they're excuses because there's nothing that you can't do. There's, just a matter of identifying what has to be done and making sure that you get it squared away. But there's ways of resolving this. There's ways of making a difference. And if it's gone into that hardcore physical piece, that can be resolved. But you also have to get rid of the trigger behind it. And there's a lot of different ways of doing it without going into hardcore, psychological problems. So we want to make sure that you have the ability to turn things around, that you can make this happen. We'll give you the tools. We're going to make sure you have the ability to change virtually anything that you want to change. It's important. What if you had all the tools? What if you had all the things? Well, we're going to give you that very, very quickly. We're coming up to that place. We're getting close to the end of the program. But make sure that you, in fact, give us a call. Join us. I think you're going to really enjoy this. I think you're going to really say, I didn't know that. And what the better part is, you can help yourself. You can make a difference. You can turn this thing around. Sometimes it's a combination of structural, chemical, emotional, and you have to treat all of them at one time. But it's critical that you get it. So join us on the 14th, Wednesday evening at 6 p.m. at the Roselle Center for Healing in Fairfax. And we'll be there and we'll show you some things that you may not have thought about when it comes to low back pain. Join me right now on Ageless Health live stream. I'm going immediately and I'm going to show you some things. And remember, I do this on an ongoing basis for one reason. I love you all. Have a great day.
Breast cancer is a major health risk to all women. It can silently grow uninterrupted for years. The Thermography Centers of Fairfax reminds all women to conduct monthly and annual breast exams. Consider a thermography scan from the Thermography Centers as an adjunct to your routine breast exams. Digital infrared thermal imaging is safe and non-invasive. For more information and to schedule an appointment, call 703-520-7591 or visit thermographycenters.com.
Neuromuscular dentistry is more than just teeth and gums. Temporomandibular joint disorder can be painful, and only a skilled neuromuscular dentist can diagnose and treat it. If you are in pain and suffering from TMD, call the neuromuscular dentistry experts at Soft Touch Dental Care. Learn more about TMD and how Dr. Michael Chung has successfully treated his patients. Call 703-319-6990 for a complimentary consultation or visit bestinsmile.com. That's 703-319-6990 or visit bestinsmile.com.
At the Roselle Center for Healing, we care about your health and want to help you take your health in a new direction, far from drugs and surgery. Knowledge is the key to optimal wellness and control of your health. We offer free health education on chronic health conditions and natural integrative medicine treatments. Register for free today.
Attend Low Back Pain on Wednesday, August 14th at 6 p.m. Space is limited, so register today. Call 703-698-7117 or visit rosellcare.com. That's rosellcare.com.
This is Dr. Tom Roselle. After 43 years of practice and over 1 million patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellcare.com. That's rosellcare.com.
Are you dental phobic? Do you neglect your dental health because of fear and anxiety? A beautiful smile begins with exceptional dental care, and you can trust in the expertise of Soft Touch Dental Care and Dr. Michael Chung. Soft Touch Dental Care is unlike any dentist office you'll ever experience. Their warm and welcoming environment is designed to soothe fears and anxiety the moment you arrive, and they're especially pleased to pamper their honored guest patients. Dr. Michael Chung is a professional and leading expert in all areas of comprehensive dentistry, including cosmetic, sedation, neuromuscular, TMJ, and implant dentistry. Offering state-of-the-art technology, Dr. Chung can give you the smile of your dreams. Arrange for a complimentary consultation today with Dr. Michael Chung and experience the expertise that makes Dr. Michael Chung so unique. Call 703-319-6990. That's 703-319-6990. Or visit bestinsmile.com. That's bestinsmile.com.